Hey there, I'm starting a series to answer your therapy questions. And this recent question I got from a viewer is, how would you charge for someone who comes in for just a hand care dressing change? My name is Wong. I'm an occupational therapist and certified hand therapist. And I've been in business for over 10 years. And about 5 years ago, I started Hand Therapy Secrets in hopes of help occupational therapists develop their clinical skills and business skills. So this question here I got from someone who's a viewer says, how do you charge for just a wound care and dressing change? I think what they're trying to say is, do you charge an evaluation or just a wound care? So here's my perspective on it, and this is essentially what I would do in my clinic. So it shouldn't depend, but it kind of does. So in an ideal world, you want to always charge evaluation. I don't care what you're doing in that first thing, but you're charging for an evaluation because it's in the evaluation that you see what is their wound like. You have to, and you should have impressions of it or take measurements of it or somehow or fashion, right? Even if they're coming only one time, because documentation at the end of the day saves our ass in case anything were to happen, right? And then you bill for it based off of that. So an evaluation literally is, what happened to you? Why are you here? Let me see what's going on. So if someone's coming in for just a wound care and a dressing change, if you've never seen them before, you have to charge for an evaluation. It doesn't matter if you're not taking measurements, right? But you have to write down what you see. You have to write down how big the wound is, how deep the wound is, what does it look like, what does it smell like, what color is it, how did they get it, what are the expectations, are there any signs or symptoms of an infection? That is all really important. And here's why I would encourage you, in a perfect world, to charge for the evaluation, because you have to denote all of that. And in terms of wound care, the risk of infection could be high because somebody has has an open wound, right? And at the end of the day, I think that you're liable if you don't do your due diligence of writing out, what do you see, how big is it, what color, how deep, and did you educate them on signs and symptoms of infection? Do you see signs and symptoms of infection, right? How did you dress it? What did you tell them? What are the expectations, right? And the expectation is patient should come back, or patient taught the patient to do it on their own, and they're expected to do it. Patient verbalizes understanding of all instructions, right? You've got to value your expertise at looking at something and knowing what is wrong or what is not right. Did I say that correctly? Right? You have to value that, because not everyone can do that. As an occupational therapist, if you have experience in wound care and dressing change, like, that's an expertise. Don't devalue that, and you need to document it, and then you need to bill it. It would be a billed time code, untimed code of an evaluation, and then whatever time you spent doing whatever it is that you're doing, which is a debridement code. And don't ask me, I don't know the codes off by heart. I use an EMR, and my EMR has it, right? And so in a perfect world, you definitely want to charge for a wound care. I mean, you definitely want to charge for the evaluation and then charge for the wound care. I always do that no matter what. I'm not saying my world's perfect, but in my world, I have to make sure that I cover my butt and my clinic's butt. And so that's what I do. Now, the reason why I say it depends is because when you are coming in from, I guess, like an insurance aspect, your company your company might have a different policy. Maybe they allow you to come in and just do a dressing change, and you don't bill for it, right? That's totally up to you, and that you have to find out your company's policy around it. But I can't imagine a company saying, oh, just do it and don't charge for it, right? Because at the end of the day, it's going to come back. it could come back. If you don't charge for a wound care, you should charge for an evaluation. But basically, you want to charge for your time. You want to charge for your time, and you want to charge for your expertise. So, yeah, I think that's my take on it. I'm trying to think of in a perfect world, or not in a perfect world. Sometimes, okay, here's an example. Like, I just thought about it right now. So sometimes this question is coming from, if you working in a doctor's office and the doctor's office just sending stuff to you, and this is a workers' comp. So most of the time, if you're a cash business like me, you're going to just charge what you charge for what it is service that you're providing. If you are if you take insurance and the insurance requires authorization, that's where you might be asking this question: can I just do it and not charge? You can do it and not charge, but then you still have to write the evaluation. You still have to write the note to cover your butt, to cover what you've done. And then you're losing money for your company because you're not charging for your time. So the company is losing money because you're not billing for it. And so if your company is like, yeah, go ahead and lose all the money, then that's different, right? But I think that question might be coming from, if you're doing workers' comp requires authorization before you evaluate somebody, and some insurance companies require authorization before you can even see somebody. So you're essentially seeing somebody at no charge, and you have to decide within your company whether that's tolerable or not. And nobody can determine that but you. But if someone was coming into my clinic, I would totally charge for an evaluation, and I would document as such. And then I would document the dressing change and the education that goes around it, because it really does cover my butt. Because they are at risk for an infection, and I would hate for someone, I mean, knock on wood, this never happened to me, but you never know, someone coming with saying, oh, you did this, you caused me to have an infection because you changed my dressing, and then you didn't document nothing. Then you're screwed. Documentation is always a way of covering your butt, right? You're documenting what you see in that snapshot of time, and especially in wound care, it's so important. So that's my take on it. If you have any other questions, definitely leave me a comment below, or if you follow me on any of the social media platforms, then if you send me a question, your question might be answered in this long form format here on YouTube. So let me know if you have any questions. But if videos like this help you, definitely click the like and subscribe button. And I'm going to leave in here another video that can show you a little bit more about wound care if you're interested in wound care. All right, take it easy until next time. Thanks.